Next up, we have Saurabh from DietOSure. Saurabh, over to you. Just in the interest of time, a quick reminder, 7 minutes or lesser would be really ideal. Please go
Okay,
ahead.
sure. Okay, sure. We'll try to do that. Very good afternoon to all of you. Very proud to be here. So I would be sharing my screen. Just give me a second. Is my screen visible to you?
Yes, Kamran. Sorry, Saurabh, we can see the screen.
Okay, sure. Very good afternoon. I'm Saurabh from DietOSure. Basically, you know, I would like to talk a bit about how technology is evolving to aid doctors in providing data-driven, personalized, and precise treatment of diabetes. So, I'm co-founder and CEO of DietOSure Labs Private Limited. We are basically an early stage startup, health tech startup, which provides enable doctors for data-driven, personalized, and precise treatment of diabetes. Our system provides trackable and quantifiable impact of medications, drugs, insulin, sleep, and activity to both patients and doctors. So yeah. Basically, what we do is that we collect, some multi-dimensional time variant data points via some peripheral devices like, CGM, activity tracker watches, body composition monitor machines. And then we collect around 2000 plus data points to enable the doctors to treat their patients effectively with the aid of this, software-based ecosystem that we provide to doctors. As to use that to provide a better kind of evidence-based treatment to their patients. So now I would like to talk about this initiative as well. So basically, in India, we do not have a lot of close collaboration between engineers and doctors. So I would really appreciate this kind of efforts taken by Dr. Amit, Dr. Sadhu for organizing such a talk where people from multiple disciplines can come and can discuss together and can showcase how they are trying to evolve the developments in the field of technologies, particularly related to diabetes. So then let's talk a little bit about the current method of treatment. How is it going on? So basically, right now we believe that doctors have very limited data points on which they are providing their recommendations on. It's like you have A1C levels, fasting, PP, and some other preliminary tests. But and even the data points that that the patient tells, like what they had in terms of meals and all, and also some of the symptoms and all, they are also not very much complete and accurate because they are based on memory itself. So that needs to be changed. Yeah. So just give me a second. I think So that needs to be changed, and that is what is happening right now as well in terms of it. So primarily talking about diabetes monitoring space, there are multiple efforts being made to to provide better CGM machines, like efforts by Abbott, Medtronics, Dexcom, Eversense, and all are being made to and Blue Novo as well, to make kind of continuous glucose monitors, which help in providing short-term feedback loops for doctors. And also a lot of efforts are being made in the field of non-invasive monitoring by companies like No Labs and Blue Semi. So that is the developments in the field of diabetes monitoring as a space. Now, a lot of efforts are being made in the diabetes management space. That is primarily the space that we are in. So there are a lot of medical evidences showing that the impact of diets are very, very individual for patients. And so in order to know that, we need to be able to quantify the individual impacts of diets, sleeps, medications and all on the patient. So we need some kind of feedback loops. And that is the place where all these companies, particularly the tech companies coming in the medical field, comes. And we also are part of that ecosystem. So So basically, in order to talk a little bit about it, yeah. So ultimately, it is all about it is all about making sense of the data that we receive from these peripheral devices. So quantifying the impact is very important, and the ultimate goal is to quantify the multiple indicators of metabolic health, like impact of diet, sleep, activity, medications, etc., on the level of glycemic controls that are achieved by the patients. And as a result, that is very important to do that. And so essentially it is about putting the numbers out, converting that collected data in terms of number and putting it out to the people, to the doctors, so that they could make sense of that data, and they could provide that kind of recommendations to the patients based on the data. Basically, we need to provide quantifiable and trackable goals on daily progress made throughout the journey of diabetes management, and essentially telling just not that if the pizza is good or bad, it is how much first impact is it generating on your diets. So yeah, and apart from this, this approach is also enabling doctors to see, how is it working, essentially generating a kind of short-term feedback loop to course correct, their treatment approach as well if it is not working. So basically quantifying the impact that is being generated in a very short amount of time as well. So now, the big difference can be made with the involvement of pattern recognition technology. So primarily there are two ways of doing it. One is basic algorithmic pattern recognition method, where you can using some basic algorithms, like in terms of our application as well, you could see how an individual person is responding in terms of multiple parameters, and you could overall paint a picture of where does this person stand in terms of metabolic score, in terms of food metabolic score for any particular food, in terms of the sleep qualities that is having, and in terms of how well of a control is it able to bring in terms of glycemic control as well. Yeah. So now, yeah, give me a second.
Saurabh, just a quick time check. Would be great if we could conclude
Yeah,
within the
actually,
next minute or so. Yeah.
yeah, I understand. So yeah, basically, let's talk about the future possibilities. So the way we see it is that a lot of such efforts are being made indigenously and also internationally to quantify such kind of impacts in terms of numbers, and gives such kind of ability to doctor to look at the data at such level of also the granularity of the data, and also at some abstract level of looking at data with the help of this feedback. And this is enabling doctors to become super doctors, and the future seems to be very exciting in terms of that. So now, talking about how can you help as a panel, you can help us in terms of the collaboration. That is one thing which we are really hoping for, in terms of joining our board as medical advisors, and providing your valuable knowledge and experience to help us make better product. Also, in terms of early adoption, you can start collaboration with us, with your clinic. We currently have multiple collaborations going on. We could start that as well, and also we could help in the you could help in the field of investments. Now, to reach out to you, you can reach out to us. You can write a mail to us at vcare@DietOSure.com, and we would love to collaborate on this.
Thank you. Hello. Yeah.
Yes.
Thank you, Saurabh. Yeah.